menstruation cramps and pains usually differ from one individual to another, and we're going to look at why you usually get those. Why is that pain there? And some of the pains that are usually abnormal, and is it normal to just have pain during your menstruation in the first place? So we're going to answer that. And mostly the affected region will be the abdomen, the lower back, and the thighs, especially the inner sides of the thighs. Those are the most affected ones. Now, before you get any further, types of dysmenorrhea. What are the types? You have two: primary and secondary. Now, primary dysmenorrhea, this is where the pain of the cramps is purely coming from you getting the menses. Nothing underlying, and there's nothing influencing apart from now you are about to get your menses, 2 to 3 days, and usually disappear once you are done with shedding of the lining. Secondary dysmenorrhea, this is whereby you find that now the pain is not actually influenced by you getting the menses, but you might have other conditions, and the pain can even start or even end just beyond the menses. You might find that it's starting earlier or even ending way late after you're done with the menses. So there might not be a relationship between this and that, and most of those are usually due to medical conditions that influences those. We have medical conditions like endometriosis, we have fibroids, we have PID, which is pelvic inflammatory disease, and we have adenomyosis. Adenomyosis is whereby you find that the uterine lining digs into the uterine wall, making it larger than necessary, meaning that during the flow, when you're getting your menses, you're going to have more blood, and you might even get clots and all those. I think we even featured that in another video. We have fibroids, which are just the growth. Endometriosis is whereby you find that now the cells of the uterine lining grows in other areas. Like, for example, you might find them in the abdominal cavity or just anywhere in the body. Pelvic inflammatory disease, you find that you have an infection in the uterus that came directly from, it can be that it came directly from the vagina, so it just went all the way up. Most of the cases usually happen due to untreated STIs and untreated UTIs. Now let's go to the causes, and we are going to start off with the primary dysmenorrhea. And this, we are going to mention something very interesting: prostaglandins, and they usually promote pain and transfer of pain from one place to another. So prostaglandins, they usually increase before you get your menses. They usually increase, and this is the reason why you find that by the you should just go and watch a video about period poops. I explained about prostaglandins very well there. It's usually lead to the changes you usually get before you get to the menses, the pain that you get, the poop that you usually get during this period, the constipation, the headaches, and all those. This is mostly due to overproduction of prostaglandins, and usually contribute to this. So prostaglandins will contribute to the pain that you're going to feel. The second reason, and by the way, prostaglandins are very important, especially when it comes to the contraction, which is now the point number 2, the uterine contractions. Now, the uterine wall will have to contract to force out the uterine lining because it's not needed anymore. Now, remember, we usually say that you have 4 hormones. We have FSH, which comes and trigger maturation of the follicle of the egg in the ovary, and then you have luteinizing hormone that will be triggered by a mature follicle in the ovary, and after maturation, now this is the LH, it will lead to now ovulation. Ovulation, you're going to expect 2 things: either fertilization or no fertilization. In case of no fertilization, this is whereby now the estrogen will shoot up and it will lead to the demolition of the wall. Now, before you get there, prostaglandins are already high, so they are going to influence the contraction. And in case you so happen to have conceived during this time, so there was fertilization, there will be something that we call a hormone that we call progesterone that will make sure that everything else stops. There will be no demolition. So there will be a mucus plug that will make sure there is nothing entering there, because they want to create a safe space for the pregnancy. So it's very important. So the prostaglandins will lead to the contraction of the walls, and this is what will expel the uterine lining because it's not needed anymore. For the secondary, you have several causes, and like we mentioned, underlying conditions like endometriosis. We have fibroids, we have adenomyosis, and also pelvic inflammatory disease, which can lead to severe or even persistent menstrual pain. And it can lead to even staggered menstrual cycles, meaning that maybe you're getting a period after two months, 3 months. Sometimes you can even get 2 times in a month. So they usually lead to what we call irregular menses, and it can lead to decreased fertility, because in case it's suppressing your ovulation or suppressing your cycle, it reduces your fertility. The other one is structural abnormalities, whereby you find that now the uterus has abnormal shapes, It can be just due to something like fibroids or just rose congenital. You are born that way, so it can lead to those. For the prevention, we have several. We start off with painkillers. Now we have several categories here. We have something like NSAIDs, non-steroidal anti-inflammatory drugs. They are particularly good because now they inhibit the production of prostaglandins. This is usually done to those who usually get those excessively painful cramps. In case you're not getting, in case they are just mild, there's no need to treat them. You just let them be. But in case they are they even disrupting your life, it's good to just have painkillers. But you really need to talk to your doctor, because sometimes when you're getting those painkillers for a long period of time, something like let's say ibuprofen, it can lead to other stomach issues and other conditions with your kidney and even your liver. So it's good to first of all talk to your doctor and see whether it will be necessary for you to even take the painkillers in the first place. Now we have heat therapy, whereby you apply a heating pad or maybe something warm or a warm compress on the lower abdomen or in between your legs, and this can provide a relief by relaxing the uterine muscles. Lifestyle changes, exercises will always win. Like I usually say, regular exercises will always win. And also make sure that you are managing your stress. And this I usually tell someone, just try to look for something that you usually do that you enjoy, especially when it comes to stress levels. Now, in case you usually enjoy going out or maybe just doing something, an activity which does not entail taking recreative drugs, just do that, because now this will reduce the stress, because stress is one of those indicated causes when it comes to menstrual pain. So just try to get something that will take you off the stress. We have diet. Try to avoid inflammatory foods and try to make sure at least you cut off the caffeine, because caffeine will make okay, by now you know that caffeine is a mild CNS stimulant, meaning that it will stimulate the brains, and this will lead to a little bit higher production of prostaglandins, and also their effects will be felt more, because now everything is now a little bit alert, because now you have the nerves that are now alert to any effects of the pain. So you're going to feel it a little bit more in case you take the caffeine. Now let's go to the secondary. And for this one, this kind of straightforward. You'll have to take care of whatever, or you have to know exactly what's causing the underlying condition. So in case it's fibroids, you'll have to have that taken care of. If it's something like adenomyosis or something like endometriosis, you'll have to go for hormone therapy or whatever that will work. So first of all, go see a doctor, make sure they know exactly what's causing that, and then from there they can treat, and this will reduce the pain. Now, in conclusion, is it normal to have pain during your menses? Yes, it's normal when you don't have those excruciating pains. Now, prostaglandins will have to be there to trigger the contraction of the uterine wall, and this is where you are going to now shed the uterine lining, because now it has to be shaken off after 28 days on a regular cycle. So if you're getting them when you're about to get your menses, and usually disappear once you are done with your menses, this is normal, and it's abnormal if it's excruciating pain. But if you're getting secondary dysmenorrhea, you'll have to have that taken care of because it's abnormal. See you in the next video.